grafts that did not take. Hello, and thank you for your reply. I had 4,500 plus hair transplant 11 days ago, and wondering if these are grafts that did not take, or if this is part of an early shedding phase. I followed post-op instructions and have used only baby shampoo mixed in a cup with water so far.
Thank you for your question. You submitted photos of several hair grafts and scabs that have shed 11 days after you had a 4,500 plus graft hair transplant. And you're asking about what to make of these parts of the surgery where you have dry hair, that whether or not these is normal shedding versus actual grafts that are not going to be viable. Well, certainly I can give you my perspective as to how I handle these types of concerns when we do hair transplant procedures. A little bit of background: I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic surgeon. I've been performing hair transplant for over 20 years, and I'm also the founder of TrichoStem Hair Regeneration Centers, a procedure where we provide procedures that we developed for a non-surgical alternative to a hair transplant for men and women with thinning hair. And I can tell you that doing hair transplant, that this experience that you have right now is not in any way unusual. When you think about the number like 4,500 grafts, that is a lot. That is a very significant number of grafts. In our hands, that would be usually 2 transplants. But that being said, you have to understand that when these grafts are placed, a certain percentage of these grafts may get dry. When they scab and they break off, the root of the hair follicle may still be in the skin while the hair breaks off on top. There are going to be some grafts that fall out with the hair follicle, or the dermal papilla and the whole part of the follicular unit coming out. And it's not just those that do fall out, but as it is part of a normal hair transplant that a certain percentage of grafts don't take. In our experience, we've had patients who came to us for additional surgery after undergoing megasession surgery, and they lost 90% of their grafts. In fact, the hair regeneration treatment evolved from our use of a material called extracellular matrix to help facilitate the healing of hair grafts and to improve the outcome in terms of the yield. You know, it's one thing to say you got 4,500 grafts, but it's another thing to say you have 4,500 grafts that are growing. You can lose anywhere from 10% or more of these grafts depending on a variety of variables. So I think it's a little bit unnecessary to actually measure every last hair. I realize that this is such an important operation, and the fact is the donor area is a limited source for the graft, so I can understand why you would be nervous. But it's important to follow your doctor's instructions, and part of that involves when you think about 11 days after surgery, within the first 2 days, the grafts are pretty solidly in. And so anything that breaks off at 11 days is usually just the upper part of the grafts. In other words, the root is still in the skin, while the hair may have broken off on top. Usually we advise people to wash their hair gently and to protect and to keep the area moist if there is scabbing and crusting. But I would also say that hair regeneration for a lot of our patients has been a great combination, even for people who had transplant surgery elsewhere. I'm not necessarily recommending this for you, but the idea, just to give you an understanding of the critical importance of wound healing and what is sometimes very frustrating in hair transplant, is you can work very hard in place all the grafts that you want to see grow. And at the same time, if you have existing hair amongst all those grafts, you want to make sure those existing hairs also don't get injured, which is a side topic, but it is not unusual to actually lose a certain percentage of native hairs when you do a transplant, because when you're making all those holes, think about it, you're making thousands of openings, you're going to traumatize existing hairs. So in our practice, we were using acellular matrix to help thicken existing hair, prevent from traumatic injury the loss of existing hair, to improve the graft's survivability. And so as a side note, people who learn about this treatment who have had transplants done elsewhere have come in about a month after surgery and have found benefit in accelerating the healing process of the grafts as well as the regrowth process of the grafts themselves, in addition to the thickening of existing hair. So there's a pretty nice synergy there. But again, going back to your concerns, I think that if you follow your instructions, and you will expect to see some of this as well. But understand, remember, the principle is still the same. The first 48 hours, the grafts are in and they're holding. You actually need a surgical instrument to take them out. So, more likely than not, the root of the hairs are still intact and they will grow. And then, of course, in the first few months, there is going to be what's called shock loss, or telogen phase of the hairs, going into an early telogen phase and shedding out the top part of the hair while the actual root is still in place, and that takes about 3 to 4 months for those hairs to grow. So I think, again, the best thing is to do ask the original operating surgeon about what to do and about your concerns. It's very important to keep this dialogue going on, and see if there's anything else you can do to help facilitate the healing of your hair transplant. So I hope that was helpful. I wish you the best of luck, and thank you for your question.